This is Dr. Brady and Dr. Jonathan here at Kalkstein Chiropractic, and this weekend is a special weekend here. We have the grip team come in, and we're learning multiple things here during this seminar. Some rehab, Dr. Jonathan's doing
structure, TSI, soft tissue work.
Yep, and then Dr. Nick, Dr. Alec, Dr. Jeff, and Dr. Warren are all doing the diagnostic piece for the grip seminar. So it's been a fun weekend, learning a lot. I know you're learning a lot.
Oh yeah.
Yeah, so
ready for you guys.
Here Bella has some questions for us.
So the first question is, what were your expectations coming into this course?
So my expectation was to gain more knowledge on the rehab side. DNS is something I necessarily learned in college, so I wanted to not only be introduced to the topic, but see how I could apply that to a clinical case here.
The same thing as far as my topic, the soft tissue part of this grip approach is definitely a combination of fascial work and kind of combining the ART aspect with it with less dynamics to it. So definitely meeting my expectations.
And the second one is, what is something new that you learned during the course?
Well, there's been a bunch of things that I've learned. How bad people are at belly breathing, and that's really important, and myself included. Not singling myself out there, excluding myself, but belly breathing, and it's just really, really crucial for low back pain, especially to have that extra support there while you're exercising.
Yeah, I would have to say definitely belly breathing is super important. I think for me, it was kind of combining a lot of the systems in place with the flow of the things here. So it's kind of making things a little bit more understanding in a way as how to implement these systems into our own flow.
And then how can you take what you've learned in this course and apply it to your practice?
Yeah, so I think definitely off the top of my head right now, I can think of a few clinical cases where I could use this, especially for those chronic conditions that are kind of sticky, not really making as much progress as we would like to here. Just getting them to activate muscles that they aren't used to activating, and see really from a diagnostic standpoint as well, to see what muscles are affected or if it's more of a structural injury.
Yeah, I would have to disagree everything that Dr. Brady said. Can't wait to implement these things for you guys. So really excited to work with you guys when you get back, or I guess when we open again.
And then the last question is, would you recommend this course to others?
100%.
1,000,000%.
I can't express it enough.
Yes.
I just can't express it enough.
All right, perfect.